master has ever fallen from the sky. So also, the Germanische Heilkunde requires a certain study. For the therapists, the Germanische Heilkunde belongs to the university. For the normal citizen, it belongs in the biology lessons. More complex than the theory is its application. You have to have enough empathy for the patient, to put yourself in the patient's shoes. This being able to empathize with the patient cannot be learned. One has this empathy, or one does not have it. The royal art in Germanische Heilkunde is the wise counsel to the patient, so that he can solve his conflict. Unfortunately, wisdom cannot be learned either. Either you have it, or you don't. Not everyone is suitable to be a therapist. But not everyone has to become a therapist either. To be able to help oneself with Germanische Heilkunde, an intellectually average talent is sufficient. Anyone who has the will, can learn to understand the 5 biological laws of nature, discovered by Dr.Hamer. This brief introduction to Germanische Heilkunde is intended to serve this purpose. I would now like to show you, dear student, the common threads in Germanische Heilkunde. From have to believe, it should become I know, and I am not afraid. What is Germanische Heilkunde all about? In a nutshell, we can say that it is about the cause of disease. Where do cancer, allergy, chronic diseases, and psychoses come from? And only the knowledge of the cause enables the therapy par excellence, namely the causal therapy. Causal therapy is the only and real therapy. It has no side effects, and usually costs very little. But what exactly is the cause? The first biological law of nature, discovered by Dr. Hamer, is also called the iron rule of cancer, and describes the cause of disease. The Dirk-Hamer Syndrome, DHS. The cause of those diseases that arise by themselves is monocausal, and therefore verifiable, the biological conflict shock. In this conflict shock, the Hamer's focus immediately develops in the brain, and can be photographed in computer tomography and thus be proven. In the conflict active phase, this Hamer's focus is disc-shaped and sharp-ringed. Dr. Hamer named this biological conflict shock after his deceased son, Dirk-Hamer Syndrome, DHS. Through his tragic death, Dr. Hamer observed this conflict shock on his own body for the first time. This DHS always has 3 criteria. It has been felt highly acute dramatic, it has been felt isolative, and one has been caught on the wrong foot. With the biological conflict, we are immediately sympathizing, with stress and with cold hands. Now, a sensible biological special program starts, which causally helps us to solve this shock moment. These SBSs do this in 3 different ways. Either by cell proliferation as, for example, colorectal cancer, liver cancer, lung cancer, breast cancer, melanoma. Or by cell loss, that is the ulcers of the squamous epithelium, or by loss of function, without cell plus or cell minus, for example in diabetes or paralysis of the skeletal muscles. These conflict-active symptoms visibly increase with the intensity and duration of the conflict. Thus, the longer the conflict lasts, the larger the tumor or cell atrophy becomes, and the more pronounced the loss of function becomes. If one were to merely fight the symptom in this conflict-active phase, without resolving the conflictive cause, the symptom would recur. Our body does not do this because of any malignancy from Mother Nature, but for the sole reason of resolving this biological conflict. Either through specific functional strengthening or specific functional failure. Basically, the organ symptom is Mother Nature's specific therapy for the cause, and helps us to resolve this biological conflict. To understand the biological sense of each SBS, one must learn to understand the whole of medicine from its evolutionary history. Ernst Haeckel formulated the sentence 100 years ago. Ontogenesis is a recapitulation of phylogenesis. In other words, the development of the embryo in the womb is a recapitulation of phylogenesis. So, from our conception, fertilization of the maternal egg by the paternal sperm, we have all gone through the complete process of becoming human over several 100 million years, in our mother's womb, in a time lapse of 9 months of pregnancy. If we look back now into embryonic development, we thus look back into the history of the development of humanity. With this, we can say that our ancestor must have been such a ring-shaped, worm-like creature. Sea anemones still look like this today. Dr. Hamer sorted all organs according to the tissue types, the germ layers. With this, he was finally able to bring a coherent system to the many different diseases. The 3 color differentiated columns represent the 3 germ layers. The left yellow column is the glandular tissue or endoderm. The middle orange column is the mesoderm and is divided into the glandular tissue and the connective tissue. The outer red column is the squamous epithelium or ectoderm, which includes the functional failures. In the case of a special program from the glandular tissue, the Hamer's focus is always on the brainstem. It can be stated that the brainstem correlates with the glandular tissue. Correspondingly, the cerebellum correlates with the glandular tissue. The cerebral medulla with the connective tissue. The squamous epithelium and the functional failures correlate with the cerebral cortex. If we now look at the whole of medicine from the history of development, we not only understand the biological sense of the special program, but also what the person associated at the moment of the biological conflict shock. Our ancestor had a primeval mouth, through which he took up the food, and delivered the excrement again. He lived in the primeval sea. His purpose in life was to eat and reproduce. His organs were from the glandular tissue, and his brain was the brain stem. His conflict potential was the food morsel. If he was too slow to catch the food morsel, he has the Hamer focus in the brain stem and the relay for the thyroid gland. The thyroid gland now makes a cell proliferation and a function amplification, according to the third biological law of nature. More thyroid hormones are produced, and thus a thyroid hyperfunction is present, Graves' disease. Thereby, however, also the little animal becomes faster in real terms, and can thus solve the cause, one was too slow. If the animal catches the morsel, then the cell division of the thyroid gland stops, and the now no longer needed cell plus is broken down in the healing phase by the associated microbes, the fungi and the fungal bacteria, tuberculous. Suppose the little animal swallows a morsel, which now lies however indigestible in the intestine, crosswise. In that case, the Hamer's focus is likewise in the brain stem and the relay for the intestinal villi cells. A little bit mouthward, the intestinal villi multiply now, and a cauliflower-like intestinal cancer develops, which produces liters of digestive juices, to be able to digest this stuck morsel nevertheless. If this morsel finally slips through, the cell division of the intestinal villi stops. In the healing phase, the intestinal cancer, which is now no longer needed, is broken down tuberculously by the fungi and fungal bacteria. What we still have to learn to understand here is that Mother Nature associates. For the little animal, it is usually about the real food morsel. For us humans today, this morsel may well be the money or the house, which one would like to take in, but cannot. Or the indigestible trouble with the mother-in-law, which lies in one's stomach. What we still have to learn here to understand is that Mother Nature associates. For the little animal, it is usually about the real food morsel. For us humans today, this morsel can also be the money or the house, which one would like to take and cannot. Or the indigestible trouble with the mother-in-law, which lies in one's stomach. So, in the case of glandular tissue, we always have cell proliferation in the active phase and thus an increase in function. Therefore, the biological sense is immediately in the conflict active phase. By an increase in digestive juices, to better digest or better absorb the morsel. Or by an increase in mucus, so that the morsel slips in or out better. If you now only cut away the colon cancer but do not solve the morsel conflict, then the symptom of colon cancer returns. Mother Nature wants to solve the cause with this. The paradigm shift in medicine is now. What must the therapy focus on? On the symptom, as before, or on the cause? Of course we have to address the cause, that is the conflict. In the healing phase, we always have a tuberculous, a necrotizing degradation in the glandular tissue due to the fungi and fungal bacteria. Similar to an apple that rots and decays. We have inherited everything from our ancestors, his digestive system and also the brain for this. The brain stem is today our oldest brain part. Our ancestors left the sea and conquered the land. He needed additional organs, the inner skins to protect himself against sharp stones. He needed an additional control unit for these additional organs, and the cerebellum had to be added. The associated conflict content here is violation of integrity, such as an attack, disfigurement, or defilement conflicts. For example, if you spit in someone's face, he may feel defiled at the hit spot. The Hamer focus is in the cerebellum, in the relay for the dermis. According to the third biological law of nature, from now on, the dermis makes cell proliferation. It is making the wall to the outside thicker. A melanoma develops, which becomes larger and larger until one can solve this defilement. The melanoma is therefore the biological sense. With the solution of this besmirching, the melanoma stops, which is decomposed in the healing phase by the responsible microbes, the fungus bacteria, also tuberculous. It begins to bleed and ooze. It also begins to stink, as any tuberculous healing phase stinks of rotten flesh. At the end of the healing phase, the melanoma is gone and no longer diagnosable by conventional medicine. With the cerebellum, Also, the first social behavior was programmed into our ancestors by Mother Nature. The mammary glands are developmentally transformed sweat glands of the dermis, which is why we also find the mammaceae in the cerebellum. If the mother has an accident with her child, and associates a conflict of care for her child, she has the Hamer focus in the cerebellum. She reacts from now on with an increase in the mammary gland cells, a so-called mammaceae. The biological sense of this is to produce more breast milk in the conflict-active phase, through cell proliferation, to give the injured child a higher chance of survival. If this child becomes healthy, this more breast milk is no longer necessary, and the cell division of the mammary gland stops. In the healing phase, the inactive mammary CA, like melanoma, is tuberculously degraded by the fungal bacteria. In each tuberculous healing phase, night sweats are also present. Then our ancestors needed a locomotor system with bones, muscles, tendons, cartilage, and so on. For these additional organs, the cerebral medulla was grown. The cerebral medulla is the seat of self-esteem. A person with healthy self-esteem has an upright gait. Someone who has collapsed in self-value has problems with his musculoskeletal system, such as scoliosis, ankylosing spondylitis, lumbago, bone cancer, anemia, leukemia, and so on. Attention! With the cerebral medulla, we are now in the cerebrum, and according to the third biological law of nature, there is now a cell loss instead of a cell proliferation in the conflict-active phase. This cell loss is called necrosis in connective tissue, and osteolysis in bone. In nature, if you can't solve a self-value collapse, these holes get bigger and bigger, until the bone breaks or the tendon snaps. In nature, one would be a prey animal that would be eaten. So here, Mother Nature does not help right away. In these programs, we must first resolve the conflict. Then in the healing phase, thanks to the responsible microbes, the bacteria, these holes are filled up again under the swelling. At the end of the healing phase, the swelling goes down again. But the bone and tendon remain thicker than they were before. Similar to the healed bone fracture, where the former fracture site also remains strengthened. A thicker bone is better than a thinner one. This functional reinforcement in connective tissue is permanent for the rest of life. For this reason, Dr.Hamer also called this connective tissue group deluxe group. Here Mother Nature does not help immediately, but only at the end of healing, but for a lifetime. The social togetherness. Our youngest brain is the cerebral cortex. It is also the most complex brain. Here the social togetherness is coordinated, and it is about separation conflicts and territorial area conflicts. The cerebral cortex controls the squamous epithelium and the functional failures. The separation conflicts. In nature, when the young is separated from the mother, it is certain death for the young. Dear mother, you will never see your young again. Forget it. In the active phase of a separation conflict, we have impaired short-term memory. So, Alzheimer's is many or severe separation conflicts. Where the most touch was associated from the mother to the child, her outer skin ulcerates. The skin begins to flake and becomes rough. Now the picture of dry neurodermatitis is present. You can imagine it as if a glue joint is torn open. This does not hurt, because it is accompanied by sensory paralysis of the outer skin. This place is sensory numb. This numbness of the skin, along with her impaired short-term memory, helps the mother more easily to forget her child, so that she can go on with her life. Mother Nature is merciful. If contrary to expectations, the child can still find its way back to the mother, this mother no longer accepts her child. She has forgotten it. If the mother can resolve her separation conflict, the ulcers of the outer skin are replenished with swelling and inflammation. However, this healing phase of the squamous epithelium proceeds without microbes, because the viruses almost certainly do not exist. So the skin reddens, it is hot, itchy, and painful. Now, dermatologists speak of skin deterioration, which is actually a healing phase. Such resolved separation conflicts include eczema, blooming neurodermatitis, hives, etc. The territorial area conflict. Mother Nature creates the biologically natural hierarchy, the alpha wolf and the sub-wolf, through territorial area conflicts. In nature also always only the strongest may pass on his genes. In nature, the single wolf is not survivable. It must organize itself in the pack, to be able to hunt successfully. So that the pack functions, it needs a structure, a command. The classic territorial fight. The stronger defeats the weaker. The weaker one has now lost his territory. He has his Hamer's focus in the territorial area, more precisely in the cerebral relay of the coronary arteries. In this loss of territory conflict, the squamous epithelium of the coronary arteries ulcerates, increasing their lumen, cross-section, and allowing more blood to reach the heart muscle. The heart becomes stronger. So, the sense of this special program is again in the active phase, just to achieve a functional strengthening by cellular atrophy. Should the inferior in this territorial fight, despite this special program and the strengthened heart, in the performance still not manage to recapture his territory, he resigns. He gives up and subordinates himself. Thus he can transform the conflict intensity down, and he can grow old with it, without dying of emaciation. He has come to terms with his conflict and resigned himself to it. He thus remains in a so-called hanging active conflict process and thereby continuously builds up conflict load. However, with his resignation his male territorial side closes itself, whereby he becomes female and gay. With us humans, such a resignation occurs after approximately 6 months. With more than 9 months conflict load, we must not solve this territorial conflict at all, because we could not survive the crisis, the classical heart attack. With regard to myocardial infarction, it should be added that it is not the blocked coronary vessel in the healing phase that is to blame, as conventional medicine erroneously assumes. Rather the fact that during the crisis no more signals are sent from the brain relayed to the heart muscle, causing the heart to stop beating. The heart attack is therefore purely a brain symptom. Bypass surgery is not a causative therapy. Moreover, if an actual occlusion, the coronary vessels themselves form regular bypass tangles of blood vessels in a short time. A program of nature, that would be impossible had that one died of the occlusion. Now, when the female ovulates in nature, the alpha is present. The second wolf has no desire, because by the active Hamer focus in the relay for the coronary arteries, his libido is almost not existed. Thus, the female always has her children from the best, from the alpha. Functional failures. Finally, I briefly would like to introduce you to the very interesting functional failures. They are all controlled by the cerebral cortex. Their conflict active phase is the functional failure, such as the loss of the sense of smell. None of these functional failures make cell proliferation or cell loss, which is why there can never be inflammation here, in the healing phase. The loss of function is about nerves. And nerves no longer divide after birth. The biological sense of these function failures is also again immediately in the conflict active phase. Mother Nature helps therefore again immediately. Just with functional failure, with a motor conflict of not being able to escape, with a paralysis of the leg musculature. And this is nothing else than the well-known play dead reflex. What does the rabbit do, which cannot escape anymore? Correct. It plays itself dead. So far, the biological order of the different special programs, to which I still come to speak finally. At the moment of the conflict shock, associations are made. An involuntary association of thoughts takes place, the so-called conflict content. This conflict content determines the localization of the Hamer focus in the brain, and thereby the organ disease. This occurs analogously in the unborn child in the womb, the infant, the adult, and even in the animal. This conflict shock is the cause of the organ disease and must be understood in its entirety, to derive a causal therapy from it. Second biological law of nature. The second biological law of nature discovered by Dr.Hamer describes the two-phase nature of all sensible biological special programs, provided that this conflict could be resolved. With the conflict, cancer begins. With the conflict resolution, cancer stops. It stops therefore the cell proliferation, it stops the cell shrinkage, and it stops the loss of function. This principle is easy to understand for everyone, and scientifically easy to prove. If we cannot resolve this conflict, the system remains single phase, with all the consequences. The patient continuously builds up conflict load. The cell plus and the cellminus become larger and larger. The loss of function takes on ever-increasing dimensions. The patient remains under permanent stress, emaciates, and wears out. Conflict resolution initiates the healing phase. With conflict resolution, the famous weight falls from the patient's soul. The vegetative nervous system immediately switches from sympathicatonia to vagatonia. The patient immediately gets warm hands, can sleep again relieved, gets an appetite again. Each healing phase takes place under edema storage, in the brain and on the organ level. In the brain, the sharp rings of the Hamer focus are now lost, and the brain relay now turns dark in the computed tomography, CT, due to this edema deposit. So, we can also see in the computed tomography, whether the conflict is still active or has already been resolved. This edema storage is a space-occupying process and now causes corresponding brain symptoms, such as nausea and headaches. At the organ level, the edema storage also causes swelling and associated pain. How do you solve conflicts? As individual as people are, so individual are their conflicts, and thus conflict solutions are always individual. There can be no patent solution. As a rule, we solve our conflicts instinctively due to the compulsive thinking that the biological conflict shock has given us. All thoughts immediately circle around the problem. Patients dream of their unresolved conflicts at night. Basically, the entire organism is oriented towards conflict resolution. We do not rest until a solution to this problem comes to our mind, such as getting divorced and starting a new life. Sometimes we solve our conflicts by chance. By chance, the lightning hits the mother-in-law, and suddenly the world looks completely different. But now, with the knowledge of these biological connections, we can find out precisely this biological conflict, and derive a patient-specific therapy from this conflict. The core of this therapy is that the weight of the patient's soul is removed. So, we help him with a wise counsel to find out of his conflict, because then cancer stops without us having treated the patient somehow in the conventional sense. This wise counsel is, as said, the royal art in the Germanische Heilkunde. With the resolution of the conflict, however, the healing phase with its specific symptoms now begins. These healing phases run vagotinous and often with fever. In such a healing phase, the patient is weak and tired. He has to recover from the strenuous conflict active phase, where he used up his energy reserves. Healing phases are accompanied by inflammation of the tissue. The previously formed tumors are tuberculously degraded, and the preceding necroses are replenished with swelling. In general, the conflict active phase is less frequent than the healing phase. Now in the healing phase, the patient thinks he is sick. The healing phase lasts about as long as the conflict active phase lasted. In the middle of the healing phase, crises also always occur, which we will look at in a little more detail later. Fourth biological law of nature. The ontogenetic, developmental, system of microbes. We need the microbes as surgeons. For example, no surgeon can remove a prostate CA without damaging the nerves, resulting in permanent incontinence and impotence. Microbes, on the other hand, can tuberculously degrade an inactive prostate CA without damaging the nerves. Such a man is then neither incontinent nor is he impotent. All microbes strictly adhere to tissue boundaries and would never attack another germ layer. Thus the nerve fibers remain unaffected in a biological healing phase with tuberculosis. All microbes work only in a vagotonic healing phase. In the previous conflict active phase, tumors developed in the old brain-controlled organs, which help resolve the triggering conflict by cell proliferation and functional enhancement. Now in the healing phase the conflict is resolved, and this tumor is unnecessary. It also no longer has cell division and is inactive. With the resolution of the conflict, the microbes now receive the command from the brain to take up their work as surgeons and to break down this tumor, which has become superfluous in a tuberculous, caseous, necrotizing manner. The tumor decays similar to an apple that rots. Thus, in these old brain-controlled healing phases, tuberculous degradation always occurs, and a typical symptom is night sweats. If you know the sweaty night sweats, then this is always a double reason to rejoice. First, you have been able to resolve your conflict, and second, you have the microbes. In the brain stem-controlled glandular tissue, we have the fungi and the fungal bacteria as the associated microbes in the healing phase. The fungal bacteria are also called mycobacteria. In the cerebellar glandular tissue, the associated microbes are the fungal bacteria. Fungi and fungal bacteria thus break down unnecessary tissue. In the case of the cerebral medulla-controlled connective tissue, the associated microbes are the bacteria. The bacteria help to replenish the necroses and osteolysis of the previous conflict active phase. The ulcers in the squamous epithelium are also refilled with swelling and inflammation, but without microbes. The viruses almost certainly do not exist at all. Since no microbe causes a healing phase but rather always works only in a healing phase, there can also be no infection. Let us assume that Dr.Hamer is right in his assertions, that the evil in our body does not exist at all, that the infection does not exist at all, that the carcinogenic substances do not exist at all. Wouldn't that be liberating? We would lose these unfounded fears and could march through life with relief. We could recognize this current corona hype for what it is, namely the biggest robbery of freedom from the world population, and the installation of a global hierarchical world dictatorship, thus the enslavement of humanity. Maybe this is also why Dr.Hamer has been fought and hushed up by the deep state for 4 decades. The crisis in the middle of the healing phase. With the resolution of the conflict, the patient visibly falls into deep vagatonia. The vessels change from narrow to wide, and he gets warm hands up to fever. In the brain and on the organ level, edema is deposited in the involved areas. The patient is in the so-called exudative phase. This edema storage causes swelling, which causes various symptoms, such as intracranial pressure and pain. The patient feels visibly sicker. And to stop this falling into vagatonia, Mother Nature has built in the crises. The crises are similar, depending on the germ layer. Actually, crises are brain symptoms. There are the brain stem crises, cerebellum crises, cerebral medulla crises, and the cerebral cortex crises. All crises are sympathicotonic with constriction of vessels, cold extremities, and cold sweat. The patient in the crisis is freezing and feels cold. Depending on the load of conflict, this crisis can be a second spike and may not always be noticed. However, it can last for several days with pre, main, and post-crises. The imposing crises are those from the cerebral cortex. In addition to the symptoms already described here, we have the absence, the migraine, the hepatic coma, the pulmonary embolism, the myocardial infarction or the epileptic seizure, and so on. All patients experience the crisis itself. The critical point, especially with large loads of conflict, is always after the crisis. The crisis has the task to steer the quasi-rudder back towards health, and therefore one must not suppress a sympathicotonic crisis with vagatonic substances. On the contrary, one must strengthen the crisis, for example with coffee. If the crisis was too weak or if the conflict load was too big, then the patient fell to death after the crisis. If the crisis was strong enough, the patient managed to find back to eutonia, health, after the crisis. At this point, the former doctors declared, the patient is now over the hill. So, the crisis was this critical mountain. Thus, with conflict resolution, the patient gets worse and worse due to edema retention. In the crisis, the patients think that their body is going crazy, or even having to die. With the onset of the crisis, the edema is squeezed out, and the patient has a urinary flood phase. He has to go to the toilet remarkably often. After the crisis, the brain relay and the organ begin to scar. Now the patient is in the scarring restitutive phase. From now on, things get better and better. At the end of the healing phase, the patient is almost like new. The microbes have degraded the tumors, and the holes have been refilled. The functional deficits have disappeared. Only scars remain in the brain and at the organ level, but they usually do not bother anymore. The patient is completely healthy again. This disappearance of cancer and regaining of health is called spontaneous healing. As is known, spontaneous healing has no side effects and costs hardly any money. In Germanische Heilkunde, spontaneous healing is the declared goal. The individual can heal himself only by eliminating the cause. A small example of a crisis you may have experienced yourself. After a resolved territorial annoyance concerning the squamous epithelium of the small curvature of the stomach pain is immediately gone. But you feel nauseous. This nausea culminates in the crisis, namely in an absence, squamous epithelium, and an epileptic seizure of the striated muscular components of the small curvature of the stomach. One has to vomit, is centralized and ice cold. Thereafter, one falls back into vagatonia. One gets warm hands again, and nausea dissipates. So, this vomiting was a crisis. What has been described so far is one task of the crisis, to steer the rudder back in the direction of health. The other task of the crisis is to check whether we could have solved the conflict in a reasonable time. If you have taken too long, you will die shortly after the crisis. I would like to explain this drastic selection of Mother Nature based on the heart attack. Let us take the territorial fight of deer. The weaker one is driven away by the stronger deer. The weaker one thereby suffers a loss of territory conflict. It cannot solve this conflict, remains conflict active, and builds up visibly conflict load. If now the wolf tears the top deer, the so far inferior deer thinks, that meets favorably. I can take over the herd again. With this, he also solves his loss of territory conflict actually and gets into the healing phase, and the crisis. Now Mother Nature checks the conflict load built up so far. If this has exceeded a critical limit, with us humans it would be 9 months for the loss of territory conflict, an empirical value. Mother Nature says meaningfully, you have needed too long for this. You are not the best to get back the right for your reproduction. And before you continue to cause trouble in the pack, I will let you die. So similarly, we must imagine the selection of Mother Nature. Now there is also the erroneous conflict resolution. Let's assume that the employee suffered a loss of territory conflict in the company due to his demotion. He is conflict active and emaciates. After 6 months, he comes to terms with the situation by saying to himself, "I'll put in the extra years before I retire. I certainly won't make any more effort for this stupid company." Thereby, he can transform down his conflict, and he could become ancient as a second wolf. Angina pectoris also subsides. Now, with retirement, a new life begins for this former employee. The problems in the company belong to the past, and now he can finally devote himself to his hobby, his bird aviary. There he can appoint himself president and soon governor general. Now, this freshly retired man suddenly has his territory back. He solves his loss of territory, which was active for well over 9 months, and about 6 weeks after retirement, he dies of a heart attack. Our Minister of Social Affairs would call this happening socially acceptable early death. Erroneous was this conflict solution, because retirement does not exist at all in nature. In the natural pack, this fellow worker or this second wolf would have remained forever, and could have become old with it. In Germanische Heilkunde, we could have advised this employee already after the conflict. Watch out with the pension. Better don't go to the pension. Stay in the company, for instance as a night porter. Maybe even without pay so that you get annoyed every day anew and thus don't solve this territorial loss conflict. You get nothing out of retirement. This example should show that it is not always about conflict resolution. Often the therapy is called, so that the affected person can survive it. Remain conflict active. The common threads. If we now arrange the so-called diseases according to the germ layers, we recognize the biological order of Mother Nature. One can almost say Mother Nature explains to us how we have to live, so that we do not become ill. She forces us biologically, but helps us immediately in need. The intestine is about the annoyance, the indigestible morsel. The thyroid gland, with its over and under function, is also about the morsel. One was too slow to get the good morsel, right lobe. Or too slow to get rid of the bad morsel of feces, left lobe. The liver parenchyma, liver cancer, is about the starvation conflict in the real sense. With the lung alveoli, it is about the morsel of air with the fear of death. The pancreas is the fight for the morsel, often inheritance conflicts. The middle ear is about the hearing morsel, with the primal eye with the choroidal melanoma about the light morsel, and so on. All these organs originate from the glandular tissue. All these special programs have a morsel conflict as the cause. All have their brain relay in the brain stem. All have cell proliferation in the conflict active, and tubercular degradation in the healing phase. All have their biological sense immediately in the conflict active phase, through a functional amplification that immediately helps to solve this morsel. Their crises are rather inconspicuous, except for cold extremities. In their healing phases, we find the fungi and the mycobacteria. In none of these programs does handedness have significance. It is a question of whether the morsel cannot be eliminated or cannot be absorbed. Let's look at the connective tissue. All these connective tissue special programs are always about a self-value collapse. It is always the handedness that is decisive. The Hamer's focus is always in the cerebral medulla. The connective tissue necrotizes in the active phase. In cartilage, this is called arthrosis or wear and tear. In the healing phase, these necroses are replenished with the help of bacteria and with swelling and inflammation. In cartilage, this healing phase is called arthritis. The crises are hardly noticeable here, except for this cold centralization. But these healing phases have it in itself with quite bad diagnoses like lymph gland cancer, bone cancer, leukemia, borreliose, etc. Example of lymph gland cancer. If we now have a patient in front of us with lymph node cancer under his right armpit, then we let him clap his hands beforehand. If he claps on the right side, we know this person has been able to solve a self-devaluation conflict towards a partner. We can now detectively explore his self-devaluation conflict, DHS, and the corresponding solution, CL, with the patient. He must have solved this self-value collapse, otherwise he would not have the lymph node swelling. The therapist would congratulate the patient on his managed conflict resolution, and the patient would be happy. The conventional medical diagnosis would spare the patient an iatrogenic follow-up conflict. You have Hodgkin's disease, and if you don't get therapy, you will die. At the end of the healing phase, this lymph node swelling would subside. The lymph node can remain palpably enlarged for life. And that is the biological purpose of the deluxe group at the end of the healing phase. A thicker lymph node is better than a thinner one. Let us consider the squamous epithelium. In the same way, one could sum up and thus also understand the always same progressions in the squamous epithelium, with its separation and territory conflicts. In the active phase, the squamous epithelium ulcerates and is replenished without microbes in the healing phase, under the swelling. The Hamer's focus is always in the cerebral cortex and the squamous epithelial special programs. The crises proceed with constriction of the vessels and additionally with an absence. The handedness is crucial. The biological sense is in the active phase, either by loss of function, sensory paralysis, or ulcerative dilation of any hollow organs. Mother Nature can do everything. She can achieve a functional enhancement through cell plus, but she can also achieve this with a cell minus. And sometimes, she achieves the biological sense even through a functional failure, as in the case of the play-dead reflex. If one has found these common threads in the Germanische Heilkunde, one can interpret the organ level. The better the therapist can deduce the many different symptoms from the scientific diagnostic chart, the more precise his questions are directed to the patient. The therapist knows exactly what to look for. If one knows the organ symptom and thus the tissue, one also knows which conflict to look for. One knows whether the organ symptom is to be assigned to the active or the healing phase. Thus one knows whether the conflict is still active or has already been resolved. A corresponding event must be detected in the patient on the level of his psyche. One knows when this conflict must have happened or been resolved, namely shortly before the first organ symptom. If one knows the handedness, one also knows whether this conflict must be with a partner or the mother-child. If the patient is just in the healing phase and has found the conflict and the solution for this conflict, then one can estimate the conflict load, and thus one knows how long this healing phase will last, and when and which crisis must take place. So one can take a look into the future. Just as one can predict the date of birth in a pregnant woman. It is really fascinating. And I promise you, if one day you could verify these biological regularities at any patient case for the first time, you will be shocked. You will have an aha experience. The 5 biological laws of nature. The 5 biological laws of nature discovered by Dr.Hamer are laws in the living. They explain the biological connections of all special programs in living individuals. Special programs, which Mother Nature gave to her own creatures on their way of life. As if Mother Nature had known from experience that such a fright moment would happen to her children. One can call this also a history of development, in which Mother Nature has developed her creatures just optimally. First biological law of nature. None of these conflictive experiences was wanted or self-induced by the individual. Always it caught the individual unprepared and on the wrong foot. Always, the individual was left on his own, or felt isolated. Always it was highly acute dramatic for the individual, so that often years later he can still remember very well this moment of shock. The brain stores this moment of fright like a photograph. Always the association was an involuntary thought assignment. This happens with us humans and analogously also with the animal, according to this biological language. As a non-separable individual, the 3 levels of psyche-brain organ always run absolutely synchronously. One must actually imagine this Hamer's compass for each level of the psyche-brain organ individually and synchronously running. If one is attentive, one can often notice the organ reaction immediately after the DHS or immediately after the conflictolysis. Second biological law of nature. If the first biological natural law describes the cause, then the second biological natural law describes the solution. These first 2 laws of nature discovered by Dr.Hamer are also the most important. The other 3 laws of nature are more descriptive in nature. Thus, one moves from the first sympathicotonic conflict active phase to the second vagatonic healing phase only with the help of conflict resolution. If we cannot solve this conflict, then the first sympathicotonic stress phase remains. Attention! There can be no alternative to natural laws. Third biological law of natural. With the biological conflict shock, the DHS, a special program now starts which helps us from a biological point of view to solve this conflict, in order to find back to normatony, health. The special programs controlled from the brain stem and cerebellum make cell proliferation in the conflict active phase. The brain stem and the cerebellum together are called the old brain. The special programs controlled from the cerebral medulla and the cerebral cortex, they make cell atrophy in the conflict active phase. The cerebral medulla and the cerebral cortex together are called the cerebrum or new brain. From the cerebral cortex, the functional failures are also controlled, which make neither cell shrinkage nor cell proliferation. Fourth biological law of nature. The fourth biological law of nature, the ontogenetic, that is developmental, system of microbes explains microbes as healing phase optimizers and surgeons of Mother Nature. Fungi and fungal bacteria tuberculously degrade the old brain tumors. The bacteria replenish the necroses in the connective tissue. In the squamous epithelium, the ulcers are also refilled with the swelling, but without microbes. The viruses do not exist. Microbes cause no contagion or infection. These are healing phases. Fifth biological law of nature. With this fifth biological law of nature, the patient also understands that the symptom in his body is not the real problem. Why should he also be afraid of an event that helps him to solve the cause of his problem? He understands that the real problem is in his company, or somewhere else. He will act causally on his own and actively eliminate the cause of his cancer. Furthermore, he will lose the utterly unfounded fear that something foreign is raging in his body and supposedly wants to eat him up. With the understanding of this fifth biological law of nature, one loses the fear of the symptom. The Germanische Heilkunde makes the patient the boss of his very personal matter, and thus free. If I may give you one more piece of advice in conclusion. Make Germanische Heilkunde your hobby. The study is admittedly a bit tedious. But you can help yourself highly efficiently. Ladies and gentlemen, that completes my content for this topic. I would be pleased to welcome you again to the next seminar video of Germanische Heilkunde. Until then, I wish you a wonderful time. Helmut Pilhar, father of Olivia,